Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Taking care of yourself during your third trimester of pregnancy. Introduction. Pregnancy lasts about 40 weeks. The third trimester of pregnancy refers to weeks 28 through 40. Taking care of yourself during your third trimester of pregnancy can help you have a healthy pregnancy and a healthy baby. This program explains how to take care of yourself during your third trimester of pregnancy. It discusses the importance of prenatal care and healthy lifestyle choices. The third trimester of your pregnancy. The third trimester of pregnancy can be physically and emotionally challenging. Your baby's size and position might make it hard for you to feel comfortable. You might be tired of pregnancy and eager to meet your baby. By now, you may have an additional 2 pounds of breast tissue. As delivery approaches, your nipples could start leaking colostrum, the yellowish fluid that will nourish your baby during the first few days of life. Wear a supportive and comfortable bra to relieve breast pain or tenderness. As your baby continues to gain weight, pregnancy hormones relax the joints between the bones in your pelvic area. These changes can lead to back pain. When you sit, choose chairs with good back support. Apply a heating pad or ice pack to the painful area. Ask a friend or family member for a massage. Wear shoes that have low heels but are not flat. Your shoes should have good arch support. You might get easily winded during your third trimester of pregnancy. Practice good posture and sleep with your upper body propped up on pillows to relieve pressure on your lungs. If you experience swelling in your ankles, feet, and/or legs, lie down or use a footrest. Elevate your legs while you sleep. Swimming may also help. As your baby moves deeper into your pelvis, you'll feel more pressure on your bladder. You might find yourself urinating more often. You may leak urine when you laugh, cough, or sneeze. If you are worried about leaking urine, panty liners can offer a sense of security. Vaginal discharge is also common at the end of pregnancy. It may be heavier than the vaginal discharge during the first or second trimester. Prenatal care. Getting regular prenatal care is the best thing you can do to keep yourself and your developing baby healthy while you are pregnant. Prenatal care is the care a woman gets during pregnancy and before her baby is born. Prenatal care includes health care, education, and counseling about how to handle a pregnancy. Healthcare providers can treat or prevent problems early when they see mothers regularly. During your third trimester, as you near your due date, you should expect weekly checkups. You may see your healthcare provider more often if you are older than 35 or if you have a high-risk pregnancy. During the third trimester, your healthcare provider will check your blood pressure and weight, as well as your baby's heartbeat and movement. Tell your healthcare provider about any signs or symptoms you've been experiencing. During the third trimester, your healthcare provider might ask you to track your baby's movements. Alert your healthcare team if the baby moves less than he or she usually does. Healthcare providers regularly screen for a common bacterium called Group B Streptococcus, or GBS, during the third trimester. GBS is usually harmless in adults. But your baby can become seriously ill if he or she is infected with GBS. The presence of GBS can be detected using a swab of your lower vaginal and anal area. After taking a sample, your healthcare provider will send it to a lab for testing. If the sample comes back positive for GBS, you may be given antibiotics during labor. The antibiotics will be given through an IV, which allows medicine to go directly into a vein. Antibiotics can help protect your baby from GBS during birth. As you get closer to your due date, Prenatal visits might include pelvic exams. Pelvic exams help your healthcare provider check the baby's position and detect cervical changes. As you near the end of pregnancy, your healthcare provider may check your lower abdomen or the top of the birth canal to feel for your baby's head. Your baby should be positioned head first. When a baby is positioned feet first to the birth canal, it is known as a breech. If your healthcare provider detects a breech, he or she may try to turn the baby. This is done by applying pressure to the abdomen, also known as external cephalic version. If the healthcare provider is unable to turn the baby so it is positioned head first, you might need a C-section for delivery. A C-section is a surgical procedure that delivers the baby through an incision in the abdomen. As you near your due date, your body will prepare itself for birth. Your cervix will begin to soften and open, or dilate and thin, or efface. These changes allow your baby to pass through the birth canal.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Diet and exercise. A woman's diet may also affect her pregnancy. The following section discusses some tips for healthy eating and activity during pregnancy. Make sure to take a multivitamin or prenatal vitamin with 400 to 800 milligrams of folic acid every day. Folic acid supports the development of your baby's nervous system. It is most important in the early stages of pregnancy, but you should take it throughout your pregnancy. Eat a variety of healthy foods during pregnancy. Choose fruits, vegetables, whole grains, calcium-rich foods, and foods low in saturated fat. Make sure to drink plenty of fluids, especially water. Always wash fruits and vegetables before eating. Do not eat undercooked or uncooked meat or fish. Make sure you handle, clean, cook, eat, and store foods properly. Do not eat fish with lots of mercury, such as shark or swordfish. During the third trimester, your growing uterus might push your stomach out of its normal position. This can cause heartburn. To prevent heartburn, eat small meals, drink plenty of fluids between meals, avoid fried foods, carbonated drinks, citrus fruits or juices, and spicy foods. Women should gain a healthy amount of weight while pregnant. Talk to your healthcare provider to learn what a healthy amount is for you. Most women gain between 25 and 35 pounds. Unless your healthcare provider tells you not to, try to get at least 2 hours and 30 minutes of aerobic activity per week. Aim for a moderate level of intensity. It is best to spread your workouts throughout the week. Lifestyle. While you are pregnant, do not smoke, drink alcohol, or use illicit drugs. Avoid secondhand smoke. Do not take very hot baths or use hot tubs or saunas. Get plenty of sleep. Find ways to control stress. Meditate, read a book, or go for a walk. While pregnant, avoid chemicals. These include insecticides, solvents like certain cleaners or paint thinners, lead, mercury, paint, including paint fumes. If you have a cat or a garden, ask your healthcare provider about toxoplasmosis. This is an infection caused by a parasite sometimes found in cat feces. If not treated, toxoplasmosis can cause birth defects. Wear gloves if you garden, and avoid cat litter. Avoid contact with rodents while pregnant. Take steps to avoid illness while you are pregnant. Wash your hands frequently.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Taking care of yourself during your third trimester of pregnancy can help you have a healthy pregnancy and a healthy baby. Getting regular prenatal care is the best thing you can do to keep yourself and your developing baby healthy while you are pregnant. Eat a variety of healthy foods during pregnancy. Choose fruits, vegetables, whole grains, calcium-rich foods, and foods low in saturated fat. Make sure to drink plenty of fluids, especially water. Unless your healthcare provider tells you not to, try to get at least 2 hours and 30 minutes of aerobic activity. Aim for a moderate level of intensity. It is best to spread your workouts throughout the week.
Thank you for using Explain.